All right, good afternoon, everyone. My name is Shiv Gaglani. I'm the co-founder and CEO of Osmosis, and I'll be moderating the second panel. Wanted to just say a couple of quick words to introduce both panels because I've been coming to ASU+GSV now for about 5 years, and when I first came here, there were no panels on health education or medical education, sort of considered more of a niche market. Obviously, COVID has changed a lot of things, and now we have 3 panels on online learning in healthcare. And the first one, which Mary Ellen is moderating, is on this concept of raising the line. I'm sure every one of you have heard the term of the second panel, which is flattening the curve, right? You've heard that term ad nauseum, and that's why we're still wearing masks, so that hopefully we don't pass on COVID. The concept of raising the line is the other half of the equation, which is, let's build health workforce capacity so that even if we have another surge, which seems like we are, whether it's COVID or other chronic diseases, we have enough clinicians and providers who are able to provide high quality healthcare. And so these panelists are incredible people to talk about that concept of raising the line. The second panel on flattening the curve is what we all know about. It's how do we promote health literacy so that we can overcome things like vaccine misinformation, which is obviously a major issue right now. And that panel has changed quite a bit. True to the form, about 3 of the panelists are practicing social distancing and flattening the curve, so they are not going to be on here on the panel. And so it's a smaller panel, in which case we're going to invite many of you to ask questions because we'll have more time, including questions of our Chief Medical Officer, Rishi Desai, who worked at the CDC as a viral outbreak researcher and is happy to field questions that you may have about COVID. Some of you are flying back to young children. You may have questions about that. And so happy to make that second panel a little more interactive than the panels typically are. So thank you, Mary Ellen, for moderating, and enjoy the panel.
Thanks so much, Shiv. Well, welcome everyone. I hope you're excited to meet everyone here on the panel. They have a lot of big ideas. They've already accomplished a lot in this space, and I think to play off what Shiv just said, really enabling us to think more broadly about population health and how do we think about upskilling, reskilling, really a community, one community at a time, and think about how we build partnerships and collaborations in some synchronized manner such that we actually start to deliver population health. So there's a huge marketplace that we have to start to serve and really enable them to think differently and behave differently to deliver on population health. So we all thought it might make sense for us to give you a brief description of population health so you have a little bit of perspective. So I'm going to put my glasses on so I can read it to you. So population health prioritizes early detection, treatment, mitigation of, and rehabilitation following diseases among at-risk and symptomatic individuals. So that at-risk is an important part of the definition. We'll touch on that in a little bit. Diversity, equity, and inclusion concepts are still very naive in this country and yet essential to the delivery and management of population health. There is an essential localness concept considering health among groups of individuals across different demographics, ethnicity, socioeconomic backgrounds. There are both standardization as well as customization of healthcare and the management of the well-being of our communities. So use that as a backdrop. What we're going to talk about in terms of raising the line is how do we as educators work across these diverse sets of populations, some of which are in the workforce, some of which will be in the workforce, and some of which have left the workforce. But to drive population health, they all need education. So like I said, hopefully you've gone onto the app and you've read the impressive backgrounds of the panel here. And so let's jump into a couple questions. And we'll start with Renil, who is the president of healthcare at Emeritus, another very large education organization. You know, Renil, that burnout and turnover and early retirement are all on the rise. The interesting thing is if you watch the generational gap between boomers and millennials has really created somewhat of a cavernous gap between one generation that is moving towards retirement and one generation moving into leadership. So as you think about bringing in population health and you think about the breakdown in mentoring between the current leaders and the incurrent leaders, what do you think of as your job and how do you help develop this next generation of leaders to deliver population health and drive behavioral change differently?
Yeah, so there are two key pieces there. I think one is the increasing turnover, and number two is digital transformation. So if you think of the turnover, there are two drivers. One is the burnout and the compassion and care fatigue. You have a whole increased number of people leaving their professions, as well as the other side, we see retirement being accelerated by some of the healthcare leaders. So you have turnover in the healthcare workforce as well as among the healthcare leadership. At the same time, during COVID, we had to rapidly adapt to various digital technologies, including telemedicine and telehealth. The utilization have increased dramatically, and it's not going to fully go away. So this presents two challenges and two opportunities, which is not only do we have to think about replacing the turnover of healthcare leaders, we'll have to skill them differently. We will have to create a healthcare leadership that is not only comfortable, but can thrive in the new environment and leverage these technologies to optimize patient outcomes as well as lead teams in that setting. So what we are working on really is trying to pull together the best in higher education, the best in the industry, and then technology to pull all this together to create a solution so that we can start early in career and identify high potential talent and create a true workforce solution that can work with the industry to develop these people to acquire the skills they need to be effective leaders and lead in a setting that we see is being created. So that's some of the work that we are working on.
Awesome, awesome. Leadership is critical to driving behavior change in the future, so glad you're at the helm of that. Derek, let's move on to you. Derek, as you may all know, is the COO of Osmosis, and you all have done an incredible job, one of the fastest growing med-ed companies in the country, and your philosophy towards animations, making content sort of relatable and approachable has really enabled you to scale faster than most of us in this marketplace. So that was a nice lesson for us. How do you scale content? Then you took it to the next level and partnered with YouTube, really starting to go to the other side of the coin, if you will, of population health, which is how do we get to the patients, right? And enable them to manage their conditions better, live healthier lives, and understand how to access healthcare appropriately. So I guess our question for you is, how do you think about aligning both clinical and non-clinical caregivers? and with patients, with the goal of trying to drive patient outcomes and making sure that care is accessible to all members of the community?
Thanks, Mary Ellen, for those kind words. So we look at the audience for our content really in three different segments. One, as you mentioned, our patients, the general public. We have partnered with YouTube to put a lot of authoritative, accessible content out there. It's not everything we do because we're in business and trying to grow. But we think that's important for the general public to have accessible information that's engaging enough for the public to get through and absorb and retain what they need to know. So if somebody in the public is seeking information, it's there for them from us and other sources. We also work with providers who use that content and more from our library to send videos, content to their patients. We often hear from providers that they don't have enough time in their visits, their office visits, to adequately explain complicated healthcare topics. An interesting statistic is that the average reading level in the United States is the 7th or 8th grade. And that's just the average, so, and that's for adults. So yeah. There's some folks who read at an elementary school level. So if a doctor is trying to explain a complicated healthcare topic to somebody who has those kinds of challenges, literacy challenges, it's no surprise that a lot of folks walk out of a doctor's appointment not knowing what they should do next. So we're working with those partners to try to get short bits of video, which most people can absorb, get through, In our partnership with YouTube, we hear that our style of video, because of that whiteboard animation style, is often watched longer than other kinds of video that's available on YouTube. So we think that's helpful. Lastly, the segment that we also focus on, of course, is learners, students in medical school, nurse practitioners, physician assistants, excuse me, the mask is a little stuck here. Physician assistants, nurses, and other healthcare disciplines. So what we try to do there is take the factual information and chunk it down. So instead of students having lecture and taking up a lot of class time, they can watch the videos, answer questions, do flashcards, rewatch videos if they have complicated topics. And then faculty and administrators can use that time for what we think are more important healthcare topics. And these are the topics that Renil mentioned. Becoming a healthcare leader of an interdisciplinary team, learning about electronic medical record systems, developing soft skills and empathy, an open mind, so you can deal with all the stress that comes with healthcare today. So we approach it from all those angles to try to create a better educated general public, more confident providers of healthcare, and then the students in school better prepared for the work in the field after graduation.
It's awesome. That's, the way you are able to scale content in a market that's very hard and expensive to create content, really, really impressive. And I guess I would also add the impressive thing about the education through the physicians is you're also starting to build trust between the patients and the physicians and through that personalized experience so that I can take it in at my own rate. And that trust will drive behavior change, hopefully, towards healthy living. So congratulations, lots of lessons for us to learn from there. Alvin is the physician and clinical training lead at Kaplan, another small education company in our country. I'm sure the crowd will be interested in your impressive simulation models and really, talk about scaling the ability of your models, virtual simulation models to endlessly adapt is impressive and enables you to deliver personalized experiences based on gaps and understanding. As you think about the importance of communication between nurses, physicians, patients, and caregivers, and you think about enabling population health, how will your simulations build providers to patients and caregivers in a meaningful way?
Well, we are already in the midst of that journey. I think an interesting way to look at it is if you look at 2020 and one population health stat that jumps out to me is life expectancy in the US dropped by a year and a half in 2020. So we took a big step back from about 75 to, 73 and a half. And as we know, those of us who are in diverse populations in Chicago, myself, that is by no means a number that really describes what's going on in some of our communities. So the imperative for DEI, if you connect it to, a life expectancy, just a really raw number like that, it's really disproportionate amongst communities. So how do you deal with that situation? We all have different ways. Education plays a role. I think simulation is one of the most powerful levers we have for this because the world is changing. So how do it's hard to do that with the textbook, obviously. It's hard to do that with even catch up with it with teaching, but you can create virtual worlds where you can walk a mile in somebody else's shoes, and we need providers to be able to do that. Those of you who caught one of the first sessions yesterday with DreamWorks and Alien Zoo, I think really spoke to that. That's a biology simulation. Our simulation is of a patient encounter. There's others that do that as well, but you can simulate a provider stepping into communities and also taking on other identities. The gentleman from DreamWorks talked about a simulation where you could see yourself in the mirror, but it doesn't need to be yourself. It could be taking the place of somebody else. We are experimenting with that at Kaplan and iHuman. We've gotten that asked for by clients to represent a broad range of race, ethnicity, gender identity, socioeconomic status, both on the patient and the provider. So simulation can provide that really well. Of course, the other side of it is that what do you do when you connect with the patient? People often quote, it's an old stat now, but the 10,000 hours of practice, we all know that's kind of evolved to deliberate practice, and there's narrow functions on that. I know there was a blind chess demonstration, maybe some of you guys caught it. I think there's another iteration of that. Medicine's not that, right? It's not 10,000 hours in one thing. You're actually trying to get people to be good at such a broad, diverse array of skills. It's probably close to 100,000 hours or 500,000 hours, but if you just take the 10,000 hours, it takes about, let's call it 6 hours a day. It takes about 5.5 years to do that. And then when you do it, you're really moving into a catch as catch can such scenario. What I mean by that is, I trained in Chicago at Northwestern Memorial Hospital. It's on the Magnificent Mile. We didn't see a lot of gun violence, but just 2.5 miles away, Cook County, train there, you're going to see a totally different population. Simulation is not a panacea, but it can certainly address that. You can even out the experience, and COVID as a phenomenon, this 1.5 years of life lost, it's heterogeneous, right, across. So simulation can help on both with DEI issues. It can help with the practice that's needed. I think a lot, and help our physicians and nurses at scale really get to where they need to be in terms of competency, and not necessarily get 100 MCQs right. I think I've probably taken 100,000 MCQs in my life. Many of us have, right? I mean, it's like, did that make me better? I mean, somewhere along the line, I hope I'm better than I was yesterday, but competency is really where it's at. So that's what we're doing.
Quick question relative to that. I don't know if you're already doing this or if you're thinking about it, but as you think about the ability, when I think about diversity, equity, inclusion, diversity crosses many things, right? Clinical disease states that play out differently in different ethnicities and genders and whatnot. But also, more importantly, there's really that unconscious bias. And oftentimes, especially providers, but across nursing as well, people just don't recognize it. Are your simulations enabling sort of a self-assessment so they can really recognize that unconscious bias and how it might impact how they treat their patients?
What we're able to do, I think one of the most powerful things that we're able to do is play that reflection back in the clinical encounter with how the patient responds to you, and putting a diverse set of patients that have surprising reactions, surprising based on your own background or the patient's background. And that elicits a conversation that we facilitate through debriefs that we have experts in these fields write about. Give you, one example. We have a case that we wrote with a number of experts across the spectrum for a transgender patient who is going through IVF. I mean, there's multiple aspects of what's going on there. The person's partner gets involved in the simulation, and I think that kind of conversation is one of the most powerful ways to elicit, along with a facilitated conversation by an expert faculty member. So simulation can't do everything. You got to have that human interaction to show you.
Yeah, that's awesome. Kathy, let's switch to you. Kathy, heads up Adtalem Health, just a small organization, actually one of the largest organizations in healthcare education. And arguably the largest reach across very diverse populations with very different goals. So I have a 3-part question for you. One is, how has DEI driven you to think intentionally about curriculum changes and potentially expansion? That's the first part. The second part is, do you see curriculum altering by region of the region or community as it relates to socioeconomic profiles and disease state heat maps, or are we too early for that? Do you think that comes in the future? And the third part is, how do you think about your alumni population as another way to quickly scale and reach out to more people and drive them through the DEI lens and to delivery of pop health?
All right, you keep me honest on all 3 of those questions.
Okay.
So I'll try and start at the first. So we have almost 100,000 alums.
Wow.
And that's across physicians, veterinary, and nursing practitioners. We're not talking about the vets here today, but they have a similar set of issues that we're talking about, and both in the need and in the need to scale. And so when we think about how, and to give some perspective on our size, we graduate almost 1,000 physicians a year. Last year we graduated 14,000 students from our nursing school. So we really have, over our history, evolved into a very diverse organization. And that really starts, I would say, at every one of our campuses, but it's also been reconfirmed from, what I would describe as the top down. So we have a very diverse organization. That's not something that happens in a short period of time. It's something that happens due to real intention, as well as, I think, for our student population, the word of mouth, right? All of us get guidance on where to go to school from our friends, our family, perhaps our coworkers. And so our diversity oftentimes begets more diversity. That doesn't mean we're necessarily really where we want to be. And in fact, we've spent a lot of time in the last year and a half, as have probably everyone in this room, rethinking what we're doing and how we're doing it. And one of the first things we did was have a systemic review of our curriculum to make sure, including the vets, that our curriculum reflected intentional education of our students around all the aspects of DEI, some of which Alvin touched on. We've made changes, we've made improvements, but it is a journey, right? We will continue to need to do that. And I think that as our alums, our recent alums go out into the world, they will continue that education process as well. One thing, I'm gonna throw one statistic out though to talk about what that means from a scale perspective. I listened to a podcast that said that approximately 100,000 healthcare practitioners in the globe have passed away from COVID-19 in the last 18 months. If you just multiply that out by years of education, that's probably 1 million years of education to just get us back to where we were in terms of our ability to meet public health needs on a global scale. So what does that mean for all of us? It means that we do need to do more for our alums. It means that we need to think about and ask our alums what they need. And then sometimes that means we need to partner with some of the folks on this stage, as well as some folks probably in this audience, to make sure we're getting those tools to our alums in a way that they can digest in the middle of their very busy world, whether that be professional or personal. And so it is I think in this case, to your question, we're working really hard to make sure our graduates are prepared, but it's going to take a village to make sure all of the healthcare system itself is continuing to evolve and to deliver what our system needs and what our patients need.
Awesome.
I'm not sure if I answered all three questions.
You did. I didn't have to keep you honest at all. So Tiffany, let's move on to you and Coursera, the megaphone of the marketplace right now. You have the ability to reach really the most broad sector of anyone on the stage right now. And thinking about patients, caregivers, current workforce, future workforce, you got them all. So when you think about the broad spectrum of learner needs relative to development, upskilling, retraining, how do you take what you learned from the CDC, your time at the CDC, and drive meaningful change in the delivery of population health through the Coursera megaphone?
So I will say that to be very completely honest, when you work for the government, you must say what you were. I was a contractor. I was not a CDC employee, so please. But it did give me some exposure to that. And what I realized is that the beauty of coming to Coursera for me was the talent shortage. That was really the main thing that I noticed. The people at CDC are amazing, but again, they were suffering from the things that Renil mentioned. They're suffering from burnout. They're suffering from limited skills. They're suffering from all these other kinds of things. And so coming to Coursera was an opportunity to say, across the board, how can I really use Coursera to get the word out that there are some opportunities in health that if you are interested, if you are curious about just entering the health field, if you just want to know more so that you can help your family member and try to help kind of give them some guidance. If you want to enter in, if you want to try it out, and through our partners, whether they are university or industry, we're actually getting to like professional development. We've partnered with Osmosis. They've developed a great kind of COVID-19's continuing medical education course. We've partnered with Johns Hopkins, and then our, almost, I would say award-winning, but not to that point, of the COVID-19 contact tracing. So it really gave us a light to see that people were interested in accurate, reliable, effective information. And through Coursera, I get a chance to not just look at just the medical field or the nursing field, but also include the veterinarians, include healthcare management, include healthcare informatics, include all of those other pieces that really helps kind of support us and our healthcare professionals.
And did you teach them that the mask goes over the nose?
We try to remind people that, it's completely over the nose, that it's not just your mouth, but, baby steps. I always say with public health, we really want to help better communicate that, and I think that's something we learned. I think even when the pandemic first happened, everybody was like, okay, you said social distancing. What is social distancing? So realizing staying 6 feet apart, everybody was like, oh, that makes sense. So those are the kinds of things that I think Coursera really helps, just in terms of our courses, our specializations are really just an opportunity to get the information out to a wide audience.
One last piece for you, as you think about your various relationships with university, how do you think about communities? And, if you think about that fabulous drawing you shared with everyone on the panel that shows all aspects of the community, from government to religion to schools to, you name it, as about, 25 bubbles on that slide.
Yeah.
How do you think about sort of communicating to them and sort of rising all boats through very different learner needs and hopefully not too complex curriculum development?
Right, and I think part of where we excel in that regard is through our partnerships. So we have our university partnerships, we have our industry partnerships that we're using, and through them we're kind of really getting the information out and saying, hey, here's all the different places. And even in our industry partnerships, we don't limit it just to, the Google. We have a great, professional certificate with Google, but we're also reaching out to what are those healthcare systems? What are those healthcare insurers? What are those other organizations that also have a piece of the puzzle and can help kind of provide information and bring all of that to the table. And for me, a great example of the beauty of Coursera was our Google kind of IT support certificate. And then Johns Hopkins came in and added a specialization that became a health IT certificate. And then now Futuro Health in California is using that program to actually train health informatics specialists in California. So I think it comes through something you mentioned earlier about partnerships and collaborations. Like, even though we are Coursera and we, have 87 million learners, we're still finding ways to say, when it's possible, how can we kind of tailor our approach to whether it's a certain state, whether it's a certain region. We're also international. How can we kind of understand like what works for each organization and for each region in each area?
Awesome. So I'm going to turn back to everyone on the panel for another question, which is really related to what you just talked about. Hopefully everyone here can see everyone's focusing on a different aspect of the marketplace in very powerful ways. But what if we could all do it in a synchronous way? What if we could partner together and truly usher population health in by, really upskilling, retraining, and building into our training sort of the concept of kale and the pancakes, diversity, communication, some of those softer skills, and make sure we're delivering them across our communities. So, Kathy, I'll start with you.
Yeah, so I think in order to really do that impactfully, you also have to add in, the workforce employer, right? You have to really be connected to the employer and what they need and they see on the ground that they need, which, as Tiffany just described about, it depends on physically where you are, right? And what's happening, which stage of the variant you're in today, to be very specific, right? In terms of where that is. And then I think you also have to really pull it all the way back through to, and none of us are in this right now, the K through 12 world, right? How do we get students really interested in opportunities in healthcare, to understand what opportunities in healthcare really are and the wide variety of opportunities that exist, and connect all of that. And that is not a small puzzle to put together, although I think there are demonstrations of it across a small and wide variety of areas.
Yeah, awesome. Derek, why don't we move on to you? And I mean, you've already proven out the power of partnerships, but how do you take it one step further?
Well, that's a big topic. I think Kathy got us off to a great start. My perspective on this is a lot of providers and patients don't like the healthcare system. They're intimidated by it. We spend a lot of money on healthcare. As Alvin mentioned, we're not necessarily getting better results if you look at life expectancy and other metrics. So, why is that? Well, I think one axis is the complexity. So just going back and making sure there's a basic healthcare literacy, I think that has to start K-12 because it's that important to all of us, our families. COVID has demonstrated that it can be a global issue, healthcare, public health, and you have to build that knowledge over time. It can't just start when you walk into the doctor's office for the first time with a problem. You're not going to have the foundational knowledge that you need to be an effective consumer of healthcare information. So I think that's one angle. The other angle, providers themselves, the topic of the conversation, raising the line. From what I understand in terms of looking at the data, for the most part, we have enough students, and I'll focus on nursing a bit, entering into nursing school, even though there's a lot of nurses who are going to be retiring. The population of nurses skews a bit older. I think 50 is the average age. But too many nurses are dropping out of school. Or if they graduate, they leave the bedside after 2 years, is a recent statistic published by American Academy of Nursing. So how do we keep nurses in school and then in the profession? And I think that's making the experience of being a nurse, among other healthcare providers, more enjoyable. I think a lot of that comes from the patient interactions, and it also goes back to the training differently in school. So it's not just absorption of information, but it's a building of skills while you're in school. Being part of that team, knowing how to use the systems, having basic business skills. Healthcare is a big business in this country, even though we don't always like to admit that. It's a huge business. And being part of that ecosystem means much more than just knowing some basics about healthcare that you learn in school.
Yep.
It's being more of a complete healthcare leader. So.
Yeah. Awesome. It's so interesting so far. We have, the concept of adding employers into our loop, and really, to your point, just starting to think about health and literacy in K through 12 space. So 2 new areas that we haven't really touched on yet today. So Tiffany, expand a little more.
Well, I think the one place I would add, coming from, I have a background in public health, and I think that's a big part of the puzzle. And I think that's something that really got exposed. We spend a lot of money on treatment, but when it comes to prevention and when it comes to awareness and when it comes to those pillars of public health, we really don't support that as well. And so I think that's a big place for public health. And I think even the public health system itself is changing, and they're learning how to become much more strategic. And so even though we have these relationships, I think with Coursera, one of our relationships are with schools of public health. We have launched our Masters of Public Health degrees on our site, but we're also learning that it's necessary to have that relationship and have that partnership, have that collaboration, but it's also necessary to support them as well. So as well as you have like the medical providers or the nursing providers, having the public health infrastructure to be able to collect the data, to be able to show the spread. Everybody saw Johns Hopkins COVID dashboard that was available simply because that was, at the end of the day, it was a public health person that was behind that to help bring that data to light. And so that would be a big place that I would go. And then as well, kind of continuing like partnerships and relationships, and then also seeing who is teaching healthcare well. We know that there are relationships, there are certain organizations that really do well. All of these organizations on the stage teach healthcare really well. So how can we as Coursera even help amplify what they're doing and saying, okay, bringing that content on our platform, getting it to our learners, and then we're really kind of, like you said, the rising tide raises all boats. Everybody gets exposed, everybody has access to that information, and it's just a way to really kind of get people involved and saying, yes, I can be part of the solution, I can help push it forward.
Love it. Awesome. All right, 3 great ideas. It's getting tougher as we go on. So Alvin, as you think about that community, how do we reach beyond the teaching of population health, healthcare literacy, and really getting our employers engaged in the wellness?
Yeah, I would build a little bit on what Kathy said and take a story I heard from Tiffany, actually, which is, let's make the carnival tent bigger because we need more organizations involved. I mean, we're more focused on our health over these last 2 years than perhaps, any population of humanity has been in history, save, a couple of incidents in history. Like we talk about the plague in the Middle Ages and so forth. But there's never been a whole population in the entire globe focused on. At the same time, the trust level, especially in the United States, is probably no lower than it's ever been. So the story I'll borrow from Tiffany, I didn't know this, maybe some of you did. She shared an anecdote about how McDonald's is putting on their coffee cups information about vaccination. The reason I bring that up is that, different messages are going to resonate with different populations. We need to be agnostic, I think, to the vehicle and focus on the metric that matters. If we're all focused on life expectancy, for example, or people want to live happier, healthier, longer lives, but that is not a common definition depending on community and so forth. So make the circus tent bigger, get more people involved, be agnostic to message. I'm a coach on the weekends. I coach CrossFit, and one of the things we talk about when we're teaching complex stuff is the right coaching cue is the one that works. And I feel like it's a message here, and I give Osmosis a lot of credit here. I mean, their messaging is a great example of what creative, deliberate, effective messaging can do. It's not your only mission, but you and other organizations are doing a great job with that. So, but the same tool doesn't work for everybody.
Yeah.
Use the cue that works. McDonald's, great. I mean, that's awesome that they're doing that. There are many other organizations. Maybe you all lead some of those organizations about how to do that, and that's what I would like to see.
Yeah, love that. Awesome idea. All right, we're down to you, Neil.
Yeah, so I want to reinforce literacy and trust. So I think we saw in the past year you could be educated but not so literate in certain areas. But you need to also have trust in your community health systems and providers. And to do that, you need to actually invest more into your primary care so that those relations could be established and you can establish trust. With the digital transformation and telemedicine coming in, building trust becomes a little bit more difficult, which means you have to put in more, invest more, do things in different ways to establish that trust. The third angle to that is diversity in the healthcare systems and providers looking like the community that they're serving. That helps with trust. So those are the 3 areas. So literacy, trust, and diversity to our healthcare system to reflect the communities they represent. And yeah.
Awesome. I say, and one last closing comment. What I see is the ability potentially to really think about the certificate programs and the socioeconomically challenged in your communities, and starting to train your workforce for tomorrow if you're a healthcare system. So how do you work on educating them, bringing them in the fold, and helping them to be evangelists back home to help start living healthy lives, eating healthier, exercising, and starting to bring education, if you will, from the inside out. So that's another idea for us to think about as we think about moving population health forward and really skilling, reskilling and upskilling and retraining our workforce and our future workforces. So if anyone has any questions, I'm sure everyone here is going to make themselves available. We're going to move into the hallway so that the next panel can step up. Did you have a question you wanted to answer?
Yeah.
Yeah, I mean, almost anyone here could answer that. Keeping up with the guidelines in
Yeah.
emerging medicine is tough.
I'm happy to take that. It is a challenge, that's all I can say. I mean, it's a reality of our regulatory patchwork, right, across a number of different industries. And having experienced my prior life in financial services, I can tell you the same thing is true there. It lags where the market has gone.
Thanks very much, everyone.